Good afternoon, and thank you for joining us today as we give you an update on COVID-19 here in Erie County. First, I'd like to apologize that our sign language interpreter, Mark Blakeney, is not with us today, as he usually is. He will be back, though, for our next COVID press briefing scheduled on October 13th. As a reminder, with the rise in cases and the pandemic still raging throughout Erie County, we will continue to hold these briefings every other Wednesday at 3 p.m. to help keep you informed. Today, Erie County reports 89 new cases of COVID-19 and, sadly, 3 additional deaths. Our case count for 2021 has already exceeded the 2020 case count, and with cases remaining in the substantial transmission rate daily, I worry about the continued loss of life that we may see here in Erie County. With this current surge of COVID cases, we are experiencing more deaths among our community members. 24 deaths have been reported in Erie County in the last 30 days. Vaccines are our best layer of defense to prevent death and to reduce the most severe effects of the disease. I urge everyone who is eligible to get vaccinated. I also encourage everyone to wear a mask when close to other people who don't live with you, regardless of your vaccination status. Universal masking will be especially important as cooler weather comes upon us and more activities return to indoors. Layering all the tools that we have, vaccination, masking, hand washing, and social distancing, will help keep ourselves and our loved ones safe. The most predictable thing about COVID-19 is its unpredictability, and you do not want to be that virus's next host, nor do you want to spread it to those that you care about. Today, I am pleased to be joined by representatives from Allegheny Health Network St. Vincent, UPMC, Mill Creek Community Hospital, and the Veterans Administration Medical Center for updates from our hospital systems. So first today, I'd like to welcome Mr. John Gennaro, Director of the Erie Veterans Administration Medical Center. John?
Thank you, Kathy. Regarding an operational update, I'm pleased to report that throughout the entire pandemic, Erie VA has had no transmission of COVID in our community living center, which is our long-term care unit. This has been attributed to aggressive mitigation efforts to include routine surveillance of staff and limitation of visitors. Unfortunately, though, with the restricted visitation this week is attributed to the greater than 10% prevalence of positivity rates in the county this week. Vaccine availability, we have Moderna available, and that's available to veteran spouses, caregivers at the Erie VA and our outpatient clinics. If you can call 814-868-8661, press 2 to schedule an appointment. Regarding vaccination status of our veterans and our staff, over 60% of our veteran population has received a first dose or second dose of vaccination. We've issued over 313 booster vaccinations to veterans who meet the CDC guidelines for immunocompromised health, and that's regarding an administration of the Moderna vaccine. We encourage veterans who receive any vaccine outside of the VA to self-report this to the primary care team so we have accurate vaccination records. And regarding staff, as of October 8th, the VA will require all healthcare employees to be vaccinated. And VA was the first federal government agency to require any employee, volunteer, or contractor who works or in visits the VA to have this vaccination. Anyone hired after November 22nd of 2021 will need to be fully vaccinated to work at the VA. And this requirement ultimately will save lives, protect the veterans we serve, and the colleagues we work with. And a final note regarding our flu clinics, we will begin those this weekend, October 2nd at 9:30 till noon. That'll occur at our main Erie VA campus. And you can check out the availability of clinics at our outpatient clinics on our events page at erie.va.gov. Thanks, Kathy.
Thank you so much, John. And now I'd like to invite Dr. Chris Clark, the President and CEO of Allegheny Health Network, St. Vincent Hospital, to give us a few words from St. Vincent. Dr. Clark.
Good afternoon, everyone. Thank you, County Executive Dahlkemper, for the opportunity to report on our status at AHN St. Vincent. So since August, we've definitely seen an increase in patients tested and hospitalized for COVID-19. As a reminder, our average COVID patient daily census peaked at 54 back in December of last year. It substantially declined in the ensuing months until a low point of 1 to 2 patients per day in July. During August, our average census increased to 12, and our average COVID inpatients this month is now in the mid-20s. Today, we actually have 24 patients placed in negative airflow rooms in our designated and separate units of the hospital, and 3 patients are currently on the ventilator. We've also recognized a 20% increase in hospitalizations at the other AHN hospitals in Pittsburgh in the last week. So this is something to watch closely. As previously mentioned, testing has increased substantially during September. Our overall positivity rate of those tested is at 14%. And the 21 to 40 age group has the highest rate of positivity at this point at 20%. Pediatric cases are occurring as well, and although the positivity rate is lower at around 10%, we are testing more patients who are less than 20 years of age, just because of demand. We currently do not have any pediatric patients with COVID that are inpatients at this time. As everyone realizes, all of the hospitals are very busy these days, balancing the increase in COVID cases with a return to more normal utilization patterns and procedures. We continue to take care of all of our patients and manage the circumstances the best we can. I would advise the public to reach out to your primary care provider about COVID testing if you're recommended to do so after an exposure or if you have minor symptoms. Many times, testing can be ordered remotely if necessary to avoid a trip to the emergency room. I also want to really stress the positive impact of receiving the COVID vaccine. It is quite evident by looking at our hospitalization statistics. 80% or more of our COVID inpatients are not fully vaccinated. And that percentage is even higher for those that require intensive treatment or mechanical ventilation. Although we recognize that breakthrough COVID cases can occur, those vaccinated are much less likely to be hospitalized. To date, AHN St. Vincent has administered over 60,000 doses of the vaccine throughout the community. We are once again offering a COVID vaccine clinic on a regular basis in the McGarvey Center at the hospital. And in addition to that, we're now pleased to provide vaccine at 15 different outpatient locations, including most AHN PCP offices and also the AHN Cancer Center. To schedule, please visit ahn.org, call 814-CONNECT, or contact your AHN PCP. We offer all 3 vaccine products at this time, and we are following the CDC guidelines on who is recommended to receive a booster. Please visit our website for further information, as I know this can be very confusing. This week, AHN started offering Pfizer vaccine boosters to our employees, as is recommended by the CDC. We're also administering flu vaccines, and it is safe to receive both vaccinations at the same time. Receiving the COVID vaccine is an expectation for our employees at AHN St. Vincent, but it is not mandatory or a condition of employment at this time. Finally, we are seeing a significant increase in the use of monoclonal antibodies for those that qualify. Patients are referred for this special infusion by their PCP or the emergency department, and it's been very, very successful in reducing hospitalizations for COVID. We continue to work collaboratively with all the regional health systems and are pleased to partner with the Erie County Health Department on community events like 814 Day, or recently at the Blues and Jazz Festival at Frontier Park over the weekend, where we administered 60 vaccine doses. That's my report, County Executive Dahlkemper. Certainly open for questions later, and appreciate the opportunity to speak to everybody.
Thank you, Dr. Clark. And next, I'd like to introduce Mr. David Gibbons, President of UPMC Hammett. David?
Thank you, County Executive. Good afternoon, everyone, and thank you for this invitation to participate this afternoon. At UPMC Hammett, we are currently providing care to 35 COVID-positive patients, none of which are children. 13 of these 35 patients do require critical care and mechanical ventilation. Unfortunately, the overwhelming majority have one thing in common. They are not vaccinated against COVID-19. If you are not vaccinated, your risk of being hospitalized with COVID-19 is 29 times higher than someone who is vaccinated. Over the past several weeks, we've seen as much as 19 times more non-vaccinated patients ages 50 and younger admitted to UPMC hospitals compared to those who are vaccinated. If you do get COVID-19, UPMC Hammett is here for you. However, our goal is to keep you out of the hospital. Please call your PCP if you are having symptoms and avoid our emergency departments if you are only seeking COVID-19 testing. There are numerous collection centers throughout the community to assist with this in that setting. Help us by taking a COVID-19 vaccine, wearing a mask, spacing when indoors, staying home when sick, which is extremely important, and getting tested promptly if you have COVID-19 symptoms. If you are positive, ask if you are eligible for monoclonal antibodies. Monoclonal antibody treatment is a highly effective outpatient treatment for COVID-19 positive patients. To date, UPMC has been able to administer over 8,400 monoclonal antibody treatments. This has been proven effective and shown to prevent hospitalization and death by approximately 70%. The CDC's updated guidelines on additional doses and booster shots, we certainly encourage people who are still considering a COVID-19 vaccine to get one. UPMC recognizes, as does the CDC, that full vaccination dramatically lessens the risk of serious illness and hospitalization. UPMC Hammett is ready to vaccinate all community members ages 12 and above, as well as those that meet the booster requirements as outlined by the CDC. To schedule an appointment, either call 844-876-2822 or visit vaccine.upmc.com. For our hospitals, what makes this wave particularly challenging is the current and ongoing national workforce shortage and its impact on our ability to increase capacity. UPMC is in a better position than many given our size and the resources and our ability to share across the system, as well as incentives that we are able to provide to our staff, such as flexible shifts and overtime incentives, but we are still stretched. I would like to close by recognizing the amazing and resilient staff at UPMC Hammett and our medical staff. As we fight this pandemic, we and the entire community continue to ask of an incredible amount from our employees. Time after time, they step up, but this has been a grueling and heartbreaking 18 months. We simply could not have weathered the past year without their dedication to our hospital and to providing compassionate and world-class patient care. Thank you.
Thank you, David. And finally, I'd like to introduce Mr. Marcus Babiak, the Chief Operating Officer at Mill Creek Community Hospital. Marcus?
Good afternoon. Thank you, County Executive Dahlkemper, for the opportunity to share the current state of affairs regarding COVID-19 at Mill Creek Community Hospital. Mill Creek Community Hospital continues to follow all CDC and Pennsylvania Department of Health guidelines with regards to infection prevention and control, as well as we continue to perform surveillance testing on all patients admitted to Mill Creek Community Hospital. Furthermore, we continue to screen all staff, visitors, and vendors who enter the hospital for signs and symptoms of COVID-19. Currently, at Mill Creek Community Hospital, we have 3 COVID-positive inpatients, but none of whom are requiring a ventilator. At this time, we have no pediatric patients who have been required to have admission to the hospital due to COVID-19. We as well offered the monoclonal antibody treatment for those eligible individuals in order to reduce the need for hospitalization. With regards to third doses and booster shots for eligible patients, we continue to partner with the LECOM Center for Health and Aging located at 3910 Shaper Avenue in Erie, PA, those doses to the appropriate individuals. We currently offer clinics on Tuesdays from 8 a.m. to 11 p.m. and from 3 p.m. to 7 p.m. on Tuesdays and on Fridays from 9 a.m. to 2 p.m. with vaccines available for first, second, third, and or booster doses as appropriate, and no appointment is necessary for these vaccine series. We encourage everyone who is eligible to please get the COVID-19 vaccine. Lastly, with regards to the vaccine mandate announced by President Biden a few weeks ago, the safety of our patients and staff is always our number one priority. We will continue to review the OSHA and CMS requirements as they become available and act within compliance when they're published. Thank you again for the opportunity to share with you all today.
Thank you, Marcus, and thank you to each one of the health systems here in Erie County. We are really very blessed to have so many great facilities to offer and to give us the health care that we need. And to echo David Gibbons' comments, a great number of caregivers who are dedicated, who are working very hard every day for each one of us. And the one thing we can all do for them is to get a vaccine to help reduce their workload going forward. 5 months ago, Erie County unveiled a temporary COVID-19 memorial display at the Blasco Memorial Library. This display started with 450 white doves representing the lives lost in Erie County since the start of the COVID-19 pandemic. Since then, we have added to this display monthly in acknowledgement of the continued loss of life. It saddens me to say that we have added 61 additional doves since the installation of the memorial at the end of April. When I look at those doves as I drive by the Blasco Memorial, Blasco Library, I am struck by the vast number of our loved ones, friends, family, and neighbors who are no longer with us. We must work together to put an end to the loss of life here in Erie County. We must all take the steps which are in our power in order to stop the spread of COVID-19. This includes avoiding large crowds, especially indoors, to wear masks, and to most importantly, as been said by everyone, get vaccinated. We must not let more of our community members fall victim to the awful effects of this devastating disease. The COVID-19 vaccine is safe, effective, free, and readily available. I also want to remind everyone with the flu season approaching, we encourage them to get the flu shot also. Before I turn this over to the media, I do want to take a moment to mention a second part of Erie County's COVID-19 memorial, and that's the Book of Remembrance, which was designed locally by Kranz Books Bindery. The pages offer the opportunity for community members to share their reflections on the pandemic, including remembering those who have lost their lives and the personal experiences that you have had. The book, which is normally housed at the Blasco Library, will be traveling to the branch libraries through February. The book is currently at the McCord Memorial Library in Northeast, and the schedule can be found online or by contacting the Erie County Public Library as to the location. It's also an opportunity to do an online form for those who would prefer to add their testimonies virtually. So the form can be found at the Erie County Library website. Now I'm going to turn it over to the media, and I also want to note to the media that Melissa Lyon, the director of the Erie County Department of Health, is with us today and available for questions. And we're going to start today with Erie News Now.
Thank you, Ms. Dahlkemper. Couple of questions. Number one, we are curious to know about breakthrough cases. So how many of those have been reported in our county, as well as how many people are hospitalized with breakthrough cases right now?
Okay, I'm going to turn that over to Director Lyon, who has those statistics for us.
Thank you.
Thanks, County Executive. I actually will, we track breakthrough cases. We do them in what are called cases per 100,000 of vaccinated individuals. And I just got an update today. And so I apologize, I'm literally pulling it up right now. So it's 358 per 100,000 vaccinated. And I want to be very clear that while these are breakthrough cases, these individuals end up having less severe symptoms of COVID-19. Many of them do not require hospitalization. And as you've heard from your experts, as many of them also require less intensive therapies for recovery. I hope that helps answer your question. Back to you, County Executive.
Yes. And then the other question we had is, many of our hospitals talked about just how hard this is a time for healthcare workers. So we were wondering if the hospitals themselves are concerned for that, and if there's services in place for healthcare workers to help them work through this time.
Would one of the hospitals like to address that?
Sure. I'm happy to start, and certainly welcome Dr. Clark and the others. Yes, we are very concerned, and certainly take great efforts to care for our workforce. As I said, they've provided an unwavering level of service, and we work very closely with Safe Harbor to provide on-site counselors that are available for them. We have therapy dogs that are able to visit the staff, certainly, and we always make available meals and numerous food carts that are available to staff. And I feel like we still cannot do enough, and just thank them for their gratitude and certainly the sacrifices that they've made. And it's one that my team and I continue to evaluate every day, working with our staff, soliciting their input on what we can do to better support them.
Yeah, I agree with what David's mentioned. I mean, a lot of us are doing similar things and generally just very concerned about the compounding effect this latest spike has been on our staff, has had on our staff. We round a lot. I know all the hospital's leadership teams are probably doing the same thing, paying close attention to morale and the stress levels, the fatigue. At AHN St. Vincent, we have what we call serenity rooms, which are safe places for staff to go, generally after their shift, or if on a break, if possible. So very much paying attention to this because, it's definitely more stressful now because of the time frame that we've been dealing with this over a year and a half as recognized.
Thank you very much.
We'll go to Talk Erie, to Joel. Joel, are you with us from Talk Erie? Okay, we'll move on to Jet TV.
Kathy, this is Scott Brebner. Can you hear me okay?
I can hear you, Scott, yes.
I would just like to ask, I mean, the different hospital leaders have their own individual statistics, but it seems like the message is fairly universal that the shots are safe and effective, and yet as much as folks go out and preach every day that the sky's blue, there are those in the community that believe that the sky is green. They don't believe that these shots are safe, and they are concerned about long-term impact. And as a result, you continue to have a struggle in terms of convincing some percentage of the population to get a shot. Number one, how frustrating is that? Are we out of answers yet? I mean, what do we do besides every time we see a microphone going up and say, get a shot, because it doesn't appear that that's completely effective with a certain segment of the population that's not going to do that, kind of regardless what the argument is.
Well, I think part of this is it's a community effort. And so for those who have gotten vaccines, to speak to those that they are close with, whether it be a family member, a neighbor, a friend, and listen to them. And I think that's one thing maybe sometimes we haven't done. What are the concerns of those people who haven't gotten the vaccine yet? Is sometimes just legitimizing their concern is good. I think having them speak to their PCP, having them speak to other trusted individuals in the healthcare field is really another way that you can encourage them to get the information they need. And again, you know, sometimes when you say, I got it, I'm fine, I'm safe, I'd like you to get it too, you know, is always encouraging when it comes from somebody that they trust, whether it be their physician, whether it be their family member. And I'm opening this up if anyone else has another message around this to answer Scott's question.
Yeah, you know, Kathy, I would add to Scott's question. Scott, it's a good question for sure, and I give credit to our leadership here, Director Lyon and County Executive Dahlkemper, asking us as representatives of the health systems to speak to what it is we're seeing. So we've quoted our statistics, and they're very consistent. The only thing I might add is really what's truly remarkable is the compelling message that comes out of patients that get admitted, the not fully vaccinated patients that have regrets. We have seen it multiple times. There was something that could be done for the most part to prevent their admission at least. So that's really telling, and we're running into it on a regular basis for sure. So hopefully all of us championing what we're seeing and getting that information and those messages out there will make a difference for those that are remaining to be hesitant.
I would add to what Dr. Clark just shared. We see the very same thing at UPMC Hammett. Patients who arrive generally through the emergency department who are non-vaccinated and now COVID positive, they're pleading for the vaccine and have deep regret. So I think to the community, to Scott, to your question, we work very closely, the group of leaders on this press conference, we work very closely daily. We have weekly meetings, but it's very common for us to text and email each other and work collaboratively. So, and I welcome the community. Certainly, if someone is having question or really seeking guidance from a medical perspective, any one of our systems can provide that, and our answers are baked in science, not in political. There's no political agenda here. We're using clinical research to educate the community.
And I think it's important to add as well that we as a healthcare community continue to dispel those myths around the vaccine, and especially those promoted by social media. You know, the vaccine is safe, the vaccine is effective. The vaccine is not tied to infertility. So we just need to continue as a healthcare community to dispel those myths that are being disseminated.
Thank you. And now we'll go to Erie Times News. David, are you with us?
Follow up with Melissa about the breakthrough case rate that she had talked about. If she can provide some context to that. Is that the 358 per 100,000 vaccinated? Is that both confirmed and probable cases? Is that cumulative from the start of the pandemic? What else can you tell me about that rate?
Thanks, David. I appreciate you asking a level of detail. So I will put the caveat that we do know our data that I report to you is only as good as the data that goes into the system, right? So yes, you are correct. It would be for those that are confirmed or probables. And a probable is basically the same as a confirmed, except they didn't have they may not have had a laboratory confirmation for that, but they were a close contact, a high risk exposure, and had symptoms that demonstrates that. So it is for both of those categories, confirmed and probable. And it would be from the start of vaccine availability, from the time that someone could be fully vaccinated to date. The part that I can't tell you how much of the data might be missing. So is there the potential that we have confirmed cases in our system that demonstrate it's an unknown vaccinated status? Yeah, there's a likelihood that we have some of that. I can't tell you exactly how many of those. We've talked about having about 55% of the cases being unknown. So that's the breakthrough rate that we're able to calculate with the data that we have available. So please keep in mind, it's only as good as the data that goes in. Thanks.
Sure. And then one quick follow-up on that. The trend on this, have you seen a significant increase in this rate with Delta over the last 4 to 6 weeks or so?
I can't say that I've seen a significant increase. It definitely has been increasing, but I would say it's been incremental at best. And I did want to sort of mention that one of the reasons that the data going into the system is incomplete is sometimes we don't have individuals calling us back when we've reached out to say that they are a confirmed positive and we need more information from them. They may not return our calls, or it may not be easy to get a hold of them. So that is part of the struggle to get good data, as well as just keeping up with the number of cases that we're getting. When we have over 100 a day, it does become a struggle to keep up with getting phone calls out and comprehensive data collection. Thank you, David.
Thank you, Melissa.
And we'll go back to Erie News Now.
We have no further questions. Thank you.
No further questions? Okay. I'm going to see again if Joel is here with Talk Erie.
I am County Executive. Can you hear me?
I can hear you, Joel. Yes.
Thank you. Sorry about that. I do have a question for our hospital guests. The Pennsylvania Department of Health says there are 3 available adult ICU beds in Erie County. Does that indicate an ICU crisis?
I'll let the systems answer. Whoever wants to go first.
I'll start. We always triage patients in and out of the ICU, like our colleagues here, Joel. So we, based on the patient security and where they are in their recovery, we have the ability to move patients in and out and have the benefit of having intermediate units or step-down units that are available too for the appropriate level of care. But again, I take that question right back to what's important in our ask of the community is to receive your vaccine, practice, wear masking and spacing and distancing, because that's really helpful to us so that we don't overburden the level of care that's needed in the hospital. So again, that's our ask of you at the community. And I think it's comforting to know that the hospitals here work very collaboratively and close together. And we would always collaborate if we reached a point where we needed additional ICU beds. And we have surge plans available to address those influxes of patients.
Yeah, likewise, I agree, Joel, with David's answer, and it really does relate back to the original planning that we did moving into this pandemic and creating capacity, being able to transition staff. And so that allows for patients, at least at AHN St. Vincent, to be taken care of at the I guess the most critically ill patients being taken care of in ICU type areas of the hospital. So essentially what it comes down to is that we do have capacity to take care of more COVID patients, but I would agree that we should do everything possible to make sure that patients are, number one, appropriately utilizing the emergency department, and secondly, to get vaccinated to make sure that they downstream that you can prevent from getting infected to begin with.
Thank you.
Thank you. We'll go back to Scott at Jet TV.
County Executive, I had 2 issues that I wanted to address. Both of them were addressed in this conversation, so for the sake of brevity, I think I will pass, but I appreciate the opportunity.
Okay, thanks, Scott. We'll go back to David at Erie Times News.
Yes, Kathy, thanks. We haven't talked in a long while about cases at Erie County Prison. What kind of update can you give about the number of cases that you've seen among inmates at the prison and staff, and what kind of trends have you seen in terms of COVID cases there?
So the good news is that the mitigation efforts have been put into place have been extremely successful. We have not had any transfer of COVID within the facility since April. So that was the last COVID inmate who contracted the virus while in the jail. We have had some inmates enter the jail and they are positive coming from other facilities, sometimes from a state facility, sometimes from other facilities outside of ours. Every inmate who comes in is tested and kept isolated until we are determined that they are COVID-free, and then they can go into the general population. And of course, if they are positive, then they remain isolated until they are tested and they are COVID-free. We've had one employee a couple weeks ago, again, contracted COVID-19 outside of the workspace. Any employee who has any symptoms comes in, actually gets tested outside in the parking lot, goes back home. Because they have a medical staff there, they're able to do that. So they do the testing right there at the jail. And because of just all of these and many more mitigation efforts put into place, our jail has been, I wouldn't say COVID-free, but as COVID-free as you can get in today's world with the spread of this Delta virus.
And just to follow up on that, do you have a cumulative total of cases at the prison? And then do you also have vaccination rates for inmates and for staff?
So I know that we've had 81 inmates since the start of the pandemic. Half of those contracted outside of our jail, came in with COVID-19. And again, that's from the start of March of 2020. I do not have the rate of vaccination, but I will tell you that every inmate who comes in is offered a vaccine. And if they do get vaccinated, they actually eventually get a little bit more freedom within the jail itself because of they're safer because they're vaccinated in terms of being in a congregate setting. So it's an incentive that has worked. I think it's great because I think we're touching a population that may be less likely to have access or find access to vaccine, and we're getting them vaccinated while they're in our jail.
And a staff vaccination rate, do you have that?
I can just tell you the staff vaccination rate of the entire county. We have a little over 75% of all county staff are currently vaccinated. I don't know the exact vaccination rate at the prison, but I could probably find that out for you.
That would be great. Thank you, Kathy.
Sure. I'll get back to you on that. Okay. And we'll go back to Joel at Talk Erie. Do you have a final question, Joel?
Thank you, County Executive. I do have another question for the healthcare providers. I get a lot of questions about the lack of pediatric COVID cases in the hospital that are hospitalized. I just want to get some clarity of, is it that peds are going to Pittsburgh for that kind of care, or is it that we just have a less illness in Erie County when it comes to pediatric COVID cases?
The health systems weigh in on that.
So I'll go first. I mean, it's the former, Joel. Well, actually, I forget which one you put in order, so I apologize. But
so
to be direct,
is it Pittsburgh Children's or is it local?
It's local.
Less intense cases. Okay.
Yes. So to my knowledge, since August, and that's a time frame that I think we could correlate with the new strain, the Delta strain, we have transferred, and I've previously publicly reported this, we transferred one pediatric patient to Pittsburgh in that whole time frame. So fortunately, that is the case, and hopefully will remain as such. But all of the pediatric cases that we've been involved with have been treated as outpatients, or we've had a handful of inpatients to this point.
And similar to Dr. Clark, we've had 5 pediatric inpatients. We do have a pediatric hospitalist program, so we're able to care for those patients. But if needed, we would transfer a patient requiring a higher level of care to Children's, and we certainly would never waste time on that, and we would expedite a transfer, as would all of the hospitals here.
Thanks so much.
Okay. And finally, David, do you have a last question from Erie Times News?
Yes, there was a pretty big adjustment in the number of new cases the other day for the county. I know it was originally posted, I think, as 107, and I don't have the numbers in front of me, 173, and that was adjusted all the way down to, I believe, 84. Can you just offer, what happened with that? Was it cases that were originally tallied for Monday that were ended up being over the weekend? Just take me through, because that was one of the bigger adjustments I think I've seen from the county on daily cases.
Yes, and I'm going to turn that over to Director Lyon. I know she'll have a much better answer than I will.
Thanks, David. I think I'll start my reasoning for we're all human, and humans, sometimes we just make errors. And so in that calculation, there are a number of dates that come with the data on when it was reported versus when it was tested and when it hit our system. So it was really just a tabulation error, and it was on our part. And for that, I apologize to all on that. Thank you.
And just to follow up with that, it kind of changes the trend a little bit, and maybe in a good way. I mean, Melissa, what are you seeing with the new case trend? It seems like numbers are still going up, but perhaps not to the degree of the last few weeks. What can you tell me about the trend that you're seeing with new case numbers?
Yeah, thanks, David. And I think you and I spoke about this, I think earlier in the week, or maybe it was last week. The trends, and I'm glad they're not going up exponentially. So that's good news. They are still at a higher volume per day than I'm comfortable with in the pandemic. However, we've talked about the laboratory capacity, and turnaround times may be sort of our limiting factor or our bottlenecking factor. So it'll be interesting to see, have we just maxed out what's available for testing? Therefore, the numbers really never get significantly higher than 170 a day. I think 180 might be like our highest ever. So there is some of that that's just, I have curiosity around it. I don't know that I'll ever have a full comprehension of what our laboratory capacity is, and then when we reach it. So that's just something to keep in mind. But overall, numbers are still higher than I'm comfortable with. However, they're not growing exponentially, so we'll take that as a win. Thanks, David.
Thank you. And just one really quick follow-up to anyone there that can answer this. What are we seeing for a turnaround time on COVID testing right now? I'm hearing it's 3 to 5 days. Is that the ballpark, or is anybody from any of the places that have testing centers, can they enlighten me on if it's shorter or longer than that?
Melissa, do you want to speak from a global perspective, and then if anyone else wants to chime in?
Sure, and I'm also going to ask that my healthcare leadership that sit on the call with me recall what we had discussed in our last meeting as well. But turnaround times have increased a bit, and it depends on where the test, I have to keep in mind, it depends on where your test was collected from. So it sort of depends on who ends up being the laboratory that runs that. But I do know that turnaround times are increasing, and I'm going to not take a guess at what was reported to us earlier, and hoping that either Dr. Clark or David Gibbons has it at their fingertips for me. Thanks, gentlemen, to put you on the spot.
Yeah, no, in the time that you were answering that, I went back to my notes. So from a couple days ago, the local reference lab, ACL, was reporting 43 hours from collection time to results. So that's less than 2 days, obviously. It's been better than that for sure. But we think that it's still manageable, and I want to make sure that it's recognized that although you can get faster turnaround times in the hospital setting, so all the hospitals do have the more rapid testing ability, it's not always necessary to get the rapid test results. So we can live in this time frame of waiting 1 or 2 days to get results for sure, in order to better control the demand on testing at the local hospitals.
Thank you. Thank you all for your answers. Thank you to the media for joining us today. In closing, I ask that you do whatever you can to keep yourselves, your loved ones, our community, and especially those who cannot be vaccinated, such as our young children, safe. Get vaccinated if you are not. Wear a mask when indoors with others who are not part of your household. And if you're feeling ill, please stay home and get tested for COVID-19 before you go back out into the workplace or into the community as a whole. Each and every one of you, I ask you to please stay safe over the next couple weeks. And again, thank you to the healthcare partners who came on today with me. I greatly appreciate your being with me. Thank you.